Parkinson's disease is characterized by a gradual decline in motor control, manifesting as tremors, rigidity, bradykinesia, and postural instability. The main characteristics of Parkinson's disease is the progressive loss of the dopaminergic neurons in the substantia nigra pars compacta in the brain. These neurons are responsible for producing dopamine, a neurotransmitter essential for coordinating smooth and balanced movements. The depletion of dopamine leads to the distinctive motor symptoms of Parkinson's disease. The nervous system uses the dopamine to send messages between nerve cells. These messages also travel between the brain and the rest of their body. It travels along the four major pathways in the brain and stops in various dopamine receptors to send messages which affect movement, motor control, coordination, cognitive function, reproductive behaviors, and thinking. Another significant pathological indicator of Parkinson's disease is the presence of Lewy bodies. These are abnormal protein aggregates made mostly of alpha-synuclein that are detected within neurons. Lewy bodies are likely to contribute to neurological malfunction and death. While their significant role in Parkinson's disease pathophysiology is uncertain. While most cases of Parkinson's disease are irregular, genetic factors have been discovered to play a role in a small percentage of cases. Mutations of numerous genes, including SNCA, LRRK2, and GBA, have been linked to an increased likelihood in developing Parkinson's disease. Neuroinflammation is one of the key factors in the initiation and progression of Parkinson's disease. It is a complicated network of interactions that include both immune and non-immune cells, as well as immune response mediators. Microglia, the central nervous system's regular macrophages, plays a key role in regulating neuroinflammation and maintaining homeostasis. Microglial activity is classified into two phenotypes, pro-inflammation and anti-inflammation, with each having its own set of indicators and mediators. When the pro-inflammation microglia persist, they contribute to a variety of inflammation disorders, including neurological diseases like Parkinson's disease. The primary motor symptoms for Parkinson's disease are tremor, rhythmic shaking typically beginning in the hands or fingers, bradykinesia, slow movements making daily tasks difficult, muscle rigidity, stiffness in the limbs and trunk cause discomfort and limited range of motion. Postural instability reduces balance and coordination, raising risks of falls. Non-motor symptoms vary greatly and can have a substantial impact on one's quality of life. The key non-motor symptoms of Parkinson's disease are cognitive impairment, which can cause memory loss, slower thinking, and difficulty focusing in the cortex, mood disorders, depression, anxiety, and apathy may be caused by changes in neurotransmitter levels such as serotonin. Sleep disorders include insomnia, excessive daytime drowsiness, and REM sleep behavior disorder, which are generally caused by abnormalities in the brain's sleep-wake cycle regulator. Autonomic dysfunction can cause constipation, urine incontinence, loss of facial expressions. Understanding these symptoms pathophysiologically helps the developing targeted treatment to manage both motor and non-motor aspects of Parkinson's disease efficiently. The most effective drug for Parkinson's disease is levodopa. Levodopa is given orally and then absorbed into the bloodstream before it's delivered to the brain. Once inside the central nervous system, the enzyme dopa decarboxylase converts levodopa to dopamine, which compensates for the loss of or death of dopamine-producing neurons. This treatment improves motor symptoms associated with Parkinson's disease, as it is the primary medication for managing people with Parkinson's disease, particularly people in the early stages of the disease when their motor control is substantially impaired. Levodopa helps support more normal function but does not cure Parkinson's disease. The dose of this medicine will be different for different patients, so it is important to follow your doctor's orders or the directions on the label of the medication. The amount of medicine that you take depends on the strength of the medicine, the number of doses you take each day, the time allowed between doses, the length of time you take the medicine, depending on the medical problem for which you are using the medicine. For Parkinson's disease, the dosage is best initiated with 1 tablet of levodopa of 25 milligrams and carbidopa 100 milligrams 3 times a day. Dosages may increase or decrease depending on what is necessary until a dosage of 8 tablets of carbidopa and levodopa a day is reached. For patients like Emma, a 70-year-old female with progressive Parkinson's disease, several nursing considerations will need to be taken into account. Main one being patient education, educating the patient on the importance of taking the medicine and potential effects if a dose is missed. Also informing them to look for any symptoms that should require them to seek medical assistance. Monitoring for side effects, looking for symptoms such as dyskinesia, vomiting, nausea, or a drop in blood pressure when standing is also very important. Medication timing, ensuring the medication is given at the same time each day so it's working the best for her. Also working that around meal times and when she has an empty stomach.